So how does exercise help our heart disease? So as we said before, it improves the toxin flow back from the cells and the organs in order to come to the organs of elimination. It releases good hormones. So there is a balance of good and bad hormones in the system. So good hormones are the ones that are de-stressing, makes us happy, make us look forward to everything, and then there is gratitude involved. So that's what happens with good hormones. And also it reduces the amount of stress because it kind of takes away our focus from stress towards looking forward to with the help of healthy hormones. So it's always good. Everybody should exercise, and it's the most important thing a heart patient should do. So let's see. So whenever you have this one physical activity with the amount of this is a slide that's showing that the mortality versus physical activity. So the more physically active those people are, their lifespan is better, as well as the quality of living has improved a whole lot. So this is how we need to consider thinking about how much of exercise we have to do and what is going on with our heart health, especially when they're diagnosed with high blood pressure initially. These are all warning signs. Remember, high blood pressure, a basic amount of high levels of glucose, like borderline diabetes or hypothyroidism issues. The first thing they need to do is go back and look at the amount of exercise and sunlight you're getting, and that's the best thing we have to do. Look at it, 10 minutes or less or no exercise a day, ramp it up. So that's what everybody should be doing. If you want to stop these like high blood pressure, borderline and diabetes at the root cause, and then not take any medications. So safe exercises for heart patients. Some of you may have had a bypass procedure or may have a history of atrial fibrillation. Some may be having problems with, with stent or heart failure, like heart with low ejection fraction. So safe exercises for these patients is, first of all, walking doesn't hurt. A slow pace walking. Just go into nature, just walk around, test yourself and see how you do. Okay. So on first day, if you walk for 10 minutes, sit on the bench, relax a bit. Don't push your body too much. Then the next day, do for 15 minutes, just pile it up gradually. If you were into yoga in the past and for some reason you took a break and then you haven't gone back to it in the past few years, then again restart basic yoga, like doing Surya Namaskaras and basic exercises, and then go up with it. And if you want to learn it, we're going to be showing you a few of them today, like the basic techniques with pictures. But I think with the help of this session, this is a basic foundation session, but you're going to go to a qualified yoga instructor, take some break from your work, and then get instructions from them. Again, basic stretching, and if you are a swimmer in the past, do swimming. But walking in nature with the help of sunlight is the first thing to do, followed by yoga and basic stretching if you are kind of just starting it out. And if you've been a swimmer in the past, just start out slow, just few laps or one lap a day, and then pile it up gradually. But add some amount of exercise to your regimen. Diet is only one element to getting healthier or to get rid of all these issues with high blood pressure, diabetes and all those things. But adding exercise, getting sunlight, all these are one more, they add up. These are the other basic elements in addition to diet. So excuse me. So safe exercises, we already went over. Next slide, please.